Cupping therapy is a very safe and effective treatment modality that helps to improve blood circulation and lymphatic flow in the body. It has also been known or called negative pressure massage. I've heard the words myofascial decompression, as well as a number of other terms that have been used to describe the same modality. I like the description negative pressure massage, as we can see when the cup is applied to the skin, it lifts the tissue into the cup, and in doing so, it is creating space within the tissues underneath, thereby enabling more movement of blood and lymph in the local area. This act of negative pressure or decompression also helps to free up any restrictions that may be in the fascia or the muscle and tendinous areas that are over top of the cup. This is part of the reason why cupping is a great tool to help with pain relief. When we are freeing up an area of congestion or restriction, then usually that improvement in blood and lymph flow as well as mobility in that area helps immediately to release the pain. The other effect that you will see from applying cupping therapy is that the clients will actually report after cupping treatment, not only that they feel less pain, but that they have a sense of lightness about them. And that is because those congested tissues make the movement and the circulation more difficult for the body to do. So it is making it easier for the body to move and creating that sense of lightness. Cupping has no demonstrable negative effects on the body when practiced by a properly trained and informed practitioner. It is safe to use alongside other therapeutic treatments, as well as safe to receive while taking most medications. There are really only a few contraindications with cupping, and we will go over them in this course. Having said that, there are definitely particular clients and cases where cupping therapy is not beneficial and in fact could create harm. So as a practitioner, we need to ensure that our clients are appropriate for the treatment and that our treatment is of an appropriate length and depth, as well as that we are using the proper cupping therapy techniques. Cupping is a manual technique, and it has been used since the beginning of human existence to help release obstructions inside of the body, to increase blood flow, body fluid, remove inorganic substances, draw out bacteria and metabolic waste, and more from beneath the skin surface. It has been used for millennia as pain relief, to speed up recovery from cold and lung conditions, and to release stale blood from the body. The treatment can be very stimulating for the receiver, and yet simultaneously very relaxing. So it is also an excellent treatment for stress relief. And we don't go into the effects of stress relief extensively in this course, but what I can tell you is that cupping therapy really helps the body go into the parasympathetic response, which is the response of recovery and repair that our body is meant to be spending most of our time in. Unfortunately, in this day and age, most people are spending entirely too much time in the sympathetic response or the fight or flight reaction. So cupping really helps deeply relax the body. Because cupping is drawing blood to the local area, it is also creating a small amount of inflammation in the area because the blood by nature is 97% water. So even though ultimately it's going to release inflammation, before it does so, it does create a small amount of inflammation to activate the body's own immune system. Now, in recent times, we have seen a massive resurgence of the popularity of cupping therapy due to the media attention that it has been receiving. So first, we started to see a lot of Hollywood stars incorporating cupping into their therapeutic treatments, and the demand started to go up. I started to see in my own practice a lot more people calling up and asking for cupping therapy. Then, of course, in 2016, the Olympics came along, and there were some very famous athletes who showed up on the podium winning gold medals with cupping therapy marks on their bodies. So cupping therapy became very, very popular, and there started to be a lot of people showing up who want to talk about cupping, who want to share their expertise in cupping therapy as well. The problem is that a lot of people are not properly informing themselves on this modality and are teaching just partial truths about it, and it has the potential to cause damage or spread infections if these cautions are not taken by therapists. So it is really important that practitioners do have a proper training in cupping therapy, that they are not just going online and watching YouTube video and reading a pamphlet that has been distributed by the seller of the cups in another country where they don't have the same standards of cleaning and disinfection. So of all the positive attention that cupping has received, it also has created a little bit of negative attention or some misinformation that has to be corrected. So hopefully throughout the time we spend during this course, we will correct some of that misinformation that has been delivered to the public and also to practitioners. A few terms that have been used around cupping therapy and some mixed messages that have been sent out around it are around the idea of cupping marks, and they are often called bruises. So just to clarify what the difference between a cupping mark and a bruise is, if you look it up online or in a dictionary, you will find different description of bruises. But normally what is the description of a bruise is damage to a blood vessel causing the escape of blood into the tissues. Now, if this is the description that you're reading of cupping, then a cupping mark is definitely not a bruise. If you are performing cupping properly, there is no damage that is created in the blood vessel when the blood or the redness is coming to the surface of the body. The process is called ecchymosis, and it is a natural process where blood escapes into the tissues through a form of absorption. So this is where this natural process of the negative pressure is causing the blood cells to escape the blood vessels or the capillaries to the surface of the body. Now, when you're seeing cupping marks sometimes on people, especially if they're darker in color, that is usually an indication that those blood cells had already left the vessels and they were essentially in the interstitial fluid or the lymphatic fluid that is around the injured area. And so as we are applying the negative pressure, they're being drawn to the surface of the body so that they can be flushed out by the lymphatic system. So this is a very good thing. Another definition that I just want to talk about briefly is edema. Edema is an abnormal infiltration and excess accumulation of serous fluid in the connective tissue or in a serous cavity. So I just talked a couple of minutes ago about a little bit of edema happening or inflammation happening when the cupping vessel is attached to the body. And so this is because the suction or the negative pressure of the cup is drawing the blood and drawing the serous fluid into the area of the cup. So this is perfectly normal. When that stays and it is not able to dissipate, then that is when abnormal or pathogenic edema occurs. The next definition that I just want to go over is erythema. So an erythema is an abnormal redness of the skin or mucous membranes due to capillary congestion. So erythema is that redness that we see on the surface of the body around a cupping mark, or for people who naturally get that redness, any kind of stroke on the skin or the tissue can cause that redness. So these are the same people that if they're your massage clients or acupuncture clients, they will very quickly go red. And this redness dissipates very quickly after the trigger, whatever is causing that redness, has been removed. So here are a few of different terms or descriptions that you might see described, names for cupping. So we talked about negative pressure massage, decompression therapy, instrument-assisted soft tissue mobilization. Hijama is a special process that is performed in Islamic cultures, and there are a number of rituals involved with that treatment, so it is a very special and specific treatment. It also involves wet cupping, which means the act of bloodletting. So that is totally out of the scope of practice of massage therapists or other practitioners other than specialized hijama practitioners. And Bagwan is the translation of cupping from Chinese into the English language. So just touching base on some of the research that has been demonstrated for cupping therapy, we can talk about some of these results. The first one is that the soft tissue that is enclosed by the cup and are at the periphery of the cup are in a state of tension, while the tissue under the rim of the cup are in compression. So just to break that down a little bit, if you imagine if you're performing a massage or a palpation, you are performing compression on the body. So you are pressing in on the body, and that is pushing in and creating compression. When cupping is performed and the cup has created a negative pressure on the body, then we call that tension. And that is because the body has pulled up into the cup. So the tissue is pulled up into the cup, creating a tension or a negative pressure inside, but also slightly to the outside of the cup. So there's two different actions going on here at the same time, and we have to be a little bit aware of that, because those areas that are in compression, we want to make sure that we're not directly over the bone, and we want to also make sure that we're not directly over a bruised or injured area, because we could potentially make that worse. The second point to pay attention to in this research is that in the bulbous region of the cup, so inside of the cup, those tensile stresses tend to be greater than around the surrounding area. Another idea that we should look at is that the region being affected by cupping therapy as it goes into the body and into the tissues is actually 0.4 times the diameter of the area that the cup has been applied. So this actually starts to look like a little bit of a funnel when it's going into the body. So if the diameter of your cup, for example, is 2 inches, then you're going to get 2 times 0.04, so almost 2.5 inches of area under the surface of the cup is going to be affected. Another piece of research that has been demonstrated is that the entire thickness of the skin under the cup is similarly stressed. So that's the skin as opposed to the tissues all the way in. The tensile stresses under the cup are at a maximum in a very small area, just inside and around the rim of the cup. This is the reason why sometimes you will see the cupping marks are really only just on the inside of the rim of the cup, but they don't cover the entire area, because that area is going to have the most tensile stress due to the fact that we have the tension drawing up inside of the cup and the compression of the pressure of the cup pushing down into the body. So you have two things happening at once. So the last piece of research that is interesting that I have gathered here today is that the deepest cupping therapy treatment, right, with the deepest amount of suction on an area of the body, is capable of drawing as deeply as 65 millimeters below the surface of the skin to stimulate the recirculation of fresh blood and improve overall circulation in the body. So 6.5 centimeters, 65 millimeters is just more than 3 inches. So that is the deepest amount of suction from cupping therapy. So we definitely need to make sure that we are being very careful as to how deeply we're treating and to be very cognizant of what is under the area that we are working. So more and more evidence-based research is being prepared on cupping all the time. There are studies being done in China, in Turkey, and Iran, and now more and more in North America as well. So we are seeing research being performed by physiotherapy and chiropractors. And as these studies are more compliant with current research methods, they will be coming about, and this research will be coming more available in the next few years. At which time, probably by the time this workbook is actually published, there will even be more new research that is available. So we can see that these are very basic pointers here on the action of cupping therapy. So it is impacting the cardiovascular and the lymphatic systems. We're treating disease caused by local congestion, and cupping is causing a partial vacuum, creating a temporary blood stasis in the area. The area inside of the cup, we'll talk about cupping marks later, but that area inside of the cup will turn between bright red and dark red.